Are you a small business owner looking for ways to save money on healthcare costs? If so, this video is for you. There's a new program that we wanted to talk to you about that is kind of what we think revolutionary, and it's a great way to save money but to still help employees with their healthcare expenses. We're Shannon and Michael. We are with Healthcare Genius. And Michael, the first question that I have for you on this kind of program is, who benefits from this? Who can utilize it?
Well, certainly businesses that have not offered health insurance before because the cost of group plans was too expensive, or they didn't want to have to go through the hassle of administrating those plans, can be good candidates. But other small businesses that maybe are looking to alternatives to their group health insurance plan, and even larger businesses that maybe have never offered benefits to part-time workers or to certain classes of employees, these plans may be a benefit to them. They're called individual coverage HRAs. There's also another plan called an EB-HRA that you can use for other expenses that are out there. They are new. They just really kind of came into effect January 1 of 2020.
And the mechanics of these two different types of plans are somewhat similar. Can you walk us through how it really works and how an employer can contribute?
Yeah, so on the individual coverage HRA, basically an employer can set these up. They're going to contribute into the HRA account, and then the employee is going to take those dollars and go out and shop for individual health insurance.
Yeah, so one of the big benefits here is, as an employer, you don't have to decide what's going to be best for my employees in terms of their actual coverage. You can contribute an amount, and then they have the freedom to go pick out what's best for them. Okay. So if you have a different range of employees, you have some young, healthy employees, you have somebody who might have a family, another one who might be old, older, I don't know, somebody who might be sick. It like gives them, like you, somebody who might be so old, but it just gives your employees the flexibility to kind of find what's best for them.
That's exactly right. And when you mention that, you can basically define what you're going to contribute based on age. So for your older employees, a lot of times for individual insurance, they're going to pay a higher cost. You can pay a higher share for those employees as far as the percentage goes. So very flexible. We're seeing in Colorado, at least, some areas of Colorado where individual health insurance rates are 10, 15, 20% below what the small group rates are.
Yeah.
So we think that's a group that this may be attractive for.
Absolutely. I mean, historically, group plans were always going to be less money per employee, and that we're not really seeing that right now. So this is a huge opportunity.
That's right. Another area are for employers that maybe have employees that are over 65. They can potentially help pay for their Medicare premiums under this plan. Revolutionary. We talk a lot about in our videos about there not being very many opportunities for people to pay for health care once they're retired in a tax-free manner. This is one way, so that's another area that we think is going to be really helpful as well.
Yeah, absolutely. I mean, there are different ways that you can help your employees plan for when the time comes that they have to pay for Medicare, but this is really the only way that you can directly contribute to their premiums.
And they don't have to pay tax on it, which is key. Another area that we're seeing is a combination. So a lot of the individual health plans don't necessarily have a lot of coverage for doctor's visits. So for somebody who goes to the doctor a lot of them will cap out or 2 or 3 visits a year, and then you have to pay towards the deductible. But another way that we're looking at this is using direct primary care, which is basically a way where you pay a monthly fee to have access to a doctor whenever you need to see them.
That's right. So again, flexible, lots of different options, but this is a great way to help your employees out, and in some cases give them an option that they didn't otherwise have. So,
and I was saying, most of all, save money potentially for you, as well as save money for the employee over what they're paying currently or not paying if they don't have coverage at all.
Yeah, definitely. So my last question for you, Michael, is for any employers that are interested in learning more, how do you actually get access to one of these plans?
So there's a couple of ways to look at this. We actually have work with a local provider that's created a system to do some modeling So if you've never had a plan and you want to get an idea what this is going to look like, we can actually do modeling for you on it. Or if you have a group plan and you want to compare how that looks like to an individual plan, we can do the modeling by basically taking your employee census, which is just the dates of birth and genders and locations of your employees. We put that into the system. The system will actually even look at all the individual health plans to give an idea of what might be the best. So that's definitely a way to be looking at that. Some of these plans do require administration, that you can completely outsource the administration of it as well.
So it's actually a really simple process. Again, we think that this is really revolutionary. So it's definitely something that you should consider if you're paying more than you want to for healthcare currently, or if you want a really good way that you can help your employees out without having to be stuck in a group plan of some sort.
Again, if you want to save money, help your employees save money, go to the link below. We actually have a webinar that we're doing in a couple of weeks. The information is down there below with a third-party administrator who's going to be walking through these. Certainly join us there, but we're also willing to help in any ways we can. Get educated about these accounts because they are going to be something that will be attractive to a lot of employers.
Yeah, 100%. So again, we're Shannon and Michael. We are with Healthcare Genius and with Bespoke Healthcare. We are here to help, so let us know what questions you have in the comments below. And if you haven't already, subscribe to our YouTube channel and click the notification bell so you know when we come out with new videos.